The EV3 Solitaire AB neurovascular remodeling device is designed for the treatment of intracranial neurovascular disease. Contraindications, warnings, and instructions for use can be found in the product labeling supplied with each device. Carefully inspect the sterile package and the Solitaire AB prior to use to verify that neither has been damaged during shipment. Do not use kinked or damaged components. The EV3 Solitaire AB neurovascular remodeling device is a self-expanding design that can be completely deployed and fully retrieved by a single operator. The Solitaire AB is packaged as a single unit with the Solitaire AB, an introducer sheath, and a detachable push wire. Select a Solitaire AB based on the largest vessel diameter measuring proximal to distal. Select a Solitaire AB usable length that is at least 8 mm longer than the aneurysm neck to maintain a minimum of 4 mm on each side of the aneurysm neck along the parent vessel. An incorrectly sized device may result in inadequate aneurysm embolization, coil herniation into the parent artery, device migration, or other vessel damage. Non-clinical testing demonstrated that the Solitaire AB device is MR conditional. A patient with a Solitaire AB device can be scanned safely immediately after placement of this implant under the following conditions: static magnetic field of 3 Tesla or less, spatial gradient field of 720 Gauss per centimeter or less, maximum MR system reported whole body averaged specific absorption rate of 3 watts per kilogram for 15 minutes of scanning. In non-clinical testing, the Solitaire AB device produced a temperature rise of less than or equal to 0.7 degrees Celsius at a maximum MR system reported whole body averaged specific absorption rate of 3 watts per kilogram for 15 minutes of scanning in a 3 Tesla MR system. MR image quality may be compromised if the area of interest is in the same area or relatively close to the position of the Solitaire AB device. Optimization of MR imaging parameters is recommended. Position a suitable guide catheter employing a standard method. Connect an RHV to the fitting of the guide catheter and then connect a tube for the continuous flush action. Connect a second RHV to the fitting of the microcatheter and then connect the tube to the continuous flush. With the aid of a suitable guide wire, hold the guide wire in place and advance the microcatheter until the end of the microcatheter is positioned so that at least 4 mm of the Solitaire AB will extend past each side of the aneurysm neck along the parent vessel when fully deployed. Once the microcatheter is in place, remove the guide wire and tighten the RHV. Open the device packaging in the sterile field and remove the Solitaire AB device from the carrying hoop. Loosen the RHV and insert the distal end of the introducer sheath partially into the RHV connected to the microcatheter. Tighten the RHV and verify that fluid exits the proximal end of the introducer sheath. To achieve optimal performance of the Solitaire AB and to reduce the risk of thromboembolic complications, maintain continuous flushing action between A, the femoral arterial sheath and the guide catheter, B, the microcatheter and the guide catheter, and C, the microcatheter and the push wire and the Solitaire AB. Check all connections to make sure that during the continuous flush, no air enters the guide catheter or the microcatheter. Loosen the RHV and advance the introducer sheath until it is firmly seated in the hub of the microcatheter. Tighten the RHV around the introducer sheath to prevent backflow of blood. Confirm that there are no air bubbles trapped anywhere in the system. Transfer the Solitaire AB into the microcatheter by advancing the push wire in a smooth, continuous manner. Once the flexible portion of the push wire has entered the microcatheter shaft, loosen the RHV and remove the introducer sheath over the proximal end of the push wire. Once completed, tighten the RHV around the push wire. Visually verify that the flushing solution is infusing normally. Once confirmed, loosen the RHV to advance the push wire. With the aid of fluoroscopic monitoring, carefully advance the Solitaire AB to the desired position until its distal markers line up at the end of the microcatheter. Visually ascertain the desired position of the Solitaire AB and make any necessary correction by simultaneously moving the microcatheter and the Solitaire AB. If at any time excessive resistance is encountered during the use of the Solitaire AB or microcatheter, discontinue the delivery of the Solitaire AB and identify the cause of the resistance. Advancement of the Solitaire AB against resistance may result in device damage or patient injury. To deploy the Solitaire AB, loosen the RHV, then carefully withdraw the microcatheter in the proximal direction. Retract the microcatheter to where the detachment zone is outside the microcatheter. Tighten the RHV to prevent any movement of the push wire. If angiographic monitoring reveals undesirable positioning, repositioning of the Solitaire AB is permissible 2 times. Do not reposition the Solitaire AB in the parent vessel without fully retrieving the device. The Solitaire AB must be retrieved into the microcatheter and redeployed at the desired location or removed from the patient. Do not attempt to reposition the Solitaire AB after detachment. With the aid of fluoroscopic monitoring, hold the proximal end of the push wire in its position firmly enough to prevent the Solitaire AB from moving. Then, carefully slide the microcatheter in the distal direction over the Solitaire AB until the distal markers of the Solitaire AB line up at the end of the microcatheter. When positioned as desired, withdraw the microcatheter in the proximal direction. Prepare the patient for the procedure by inserting a sterile needle in the shoulder or groin. Plug the cable-set Solitaire into the terminal of the Solitaire detachment system. Clip the connector end of the sterile black cable onto the sterile needle. Clip the connector end of the sterile red cable onto the proximal end of the push wire, making sure the push wire rests on a dry, clean surface. Switch the Solitaire detachment system on. A periodic acoustic signal and pre-detach indicator is lit on the Solitaire detachment system, which indicates the detachment of the Solitaire AB. In the unlikely event that the Solitaire AB does move, reposition the Solitaire AB to the proper position following the previous steps. Once the Solitaire AB detachment has been detected and fluoroscopically confirmed, disconnect the red cable from the push wire and slowly withdraw the push wire from the microcatheter. Switch the Solitaire detachment system to off. When performing the technique of placing embolic coils into the aneurysm through the interstices of the Solitaire AB, use a microcatheter with a distal tip of less than or equal to 2.5 French. Perform a standard embolic coiling procedure using accepted embolic coiling practices.